The agency says 2 weeks after getting fully vaccinated, you can visit people at low risk for severe disease without wearing a mask. The CDC also says those who are fully vaccinated do not need to quarantine if they do not have symptoms of COVID-19 after coming into contact with someone who is tested positive for the virus.
Experts say we should take this transition back to some normalcy slowly, not only for the sake of our physical health, but also our mental health. Fox 12's Audrey Wheel is sharing some expert advice now to help us cope with any social anxiety as we start interacting more in person. She joins us now live. Audrey?
Right. Well, the main message here is to take it slow. We know from that CDC guidance that being fully vaccinated does not mean time to throw a party, but it does mean some more and freer social interaction, which many of us have not had for an entire year at this point, and that alone will be a big adjustment.
I start to see light peeking through the shadows, right?
It's the relief some of us finally have and others of us are desperately waiting for, being vaccinated against COVID-19.
I can see grandparents and family that I was really scared to see, and now we feel a little more comfortable.
Jason Hernandez is a senior pharmacy technician.
Being in the healthcare field as it is, at the beginning of this, it was really, really unnerving for me to interact with people, especially my elderly patients and my immunocompromised people.
He says now, having received both doses of the COVID-19 vaccine and being beyond the 2-week waiting period, plus seeing the new CDC guidance, he finally feels some freedom, even in his own home, with his fiance and relatives who live with him, being able to interact without masks and, more than anything, without so much worry.
It feels really good. It feels really, really good.
But these steps back into some normalcy will take a little bit of time for the sake of both our physical and mental health. Chief Executive of Behavioral Health for Providence, Dr. Robin Henderson, says we can't just dive right back in after a year of distance.
For this entire time, we're kind of out of practice in our social interactions. We're out of practice in how we relate with people, and that can be really intense and overwhelming.
She says start by seeing just a couple friends or maybe one other family. She says there will be fears and insecurities, and we need to take the time to really connect with others as we meet again.
We've all had a shared stressful experience, and one of the best things we can all do when we get together is talk about what that's like. What have you learned from this? What's changed for you? What are your takeaways as you go forward? Because the person that you know is not the person they were a year ago. We've all changed.
And Dr. Henderson says it is perfectly normal to feel anxious and overwhelmed right now, and you are not alone. We also talked to her about kids going back to in-person school, how parents can talk to them about that and some of the challenges they might face there, as well as some coping mechanisms we can all use moving forward here. We'll have that story for you coming up at 10:30. Reporting live in Northwest Portland, Audrey Wheel, Fox 12 Oregon.